How to survive a heart attack on your own after 67 vital suggestions that every senior needs to know. What if I told you that reading this script took 5 minutes? 12 When seniors suffer a heart attack, about half of them will be by themselves. My name is Dr. William Carson, and I've been a cardiologist for 40 years, and I've heard those heartbreaking words far too often. I simply didn't know what to do. 65% of heart attack deaths among adults over 60 really happen before they reach a hospital, frequently because vital minutes were lost due to misunderstandings or denials. But what if I told you that you could increase your odds of surviving today by understanding just 7 precise actions? My patient Richard's life was rescued by the precise life-saving procedure when he had a heart attack in his garden alone last summer. This isn't just theoretical advice. It's the precise behavior that has the potential to determine one's fate. Welcome back to Life Advice for Older People, where I'm Doctor, and we discuss the actual issues that seniors face today. William Carson, and following 40 years as a geriatric cardiologist in heart care, I've personally seen how having the right information can make a difference. Heart attacks after the age of 60 are between life and death. Particular difficulties. Your symptoms can differ from those you've heard about. Your body reacts differently to stress, and the reality that doctors don't often talk about is that when you're alone, the strategy for surviving a heart attack is very different than when you're among other people. I'll take you through the precise 7-step procedure that I teach all of my patients over 60 today, explaining why and when last summer, Richard, my 72-year-old patient, passed out by himself in his garden. These precise actions that prevented his death, before we start to see that this information is intended to keep you alive until emergency medical assistance arrives. It is not intended to replace it. In actuality, a large number of seniors live alone or spend a lot of time alone. And if you find out what to do in those crucial first few minutes, it might make all the difference. You never know whose life you might save. So please hit the like button and forward it to someone you care about. If you're new here, sign up for additional senior-specific life-saving tips. Let's start with these 7 vital actions that could save your life in the event that you have a heart attack when alone. Music. The first piece of advice is to identify the distinct warning indicators that elders exhibit. The most important life-saving advice is to identify the warning signals of a heart attack in elderly people, as they're frequently unexpectedly. Many of us were raised to believe that a heart attack was characterized by a person tightly gripping their chest. Discomfort. But in persons over 60, particularly women, the symptoms can be much. According to the most recent American Heart Association studies, it's actually quite different and considerably more subtle. 40% of elderly people who have a heart attack never experience the typical excruciating chest pain. Instead, they encounter what doctors refer to as atypical symptoms, yet they are not abnormal in any way. When it regarding seniors, allow me to present Joyce, one of my 83-year-old patients. She nearly disregarded the warning indications of a massive heart attack last year because her only symptoms were slight sudden weariness, dizziness, and what she said was an uneasy feeling without any chest discomfort. Thankfully, her neighbor saw these tiny clues and promptly dialed 911. These are the senior you need to be aware of some heart attack warning symptoms, such as abrupt, unusual weakness or weariness. Isn't your typical fatigue. Rather, it's a deep, inexplicable fatigue that feels distinct from the second shortness of breath, particularly when you're not doing anything or even when you're sleeping. If you suddenly find yourself out of breath when walking to the mailbox when it wasn't an issue yesterday, take notice to the third sudden sweating, particularly if it's clammy and cold and unrelated to exercise or temperature. Fourth, nausea, indigestion, or pain. Many elderly people misinterpret heart attacks for gastrointestinal issues. Fifth, lightheadedness and dizziness in the upper abdomen, or bewilderment for elderly people, as sudden confusion may be the sole indication of a heart attack. Other than the chest, unexplained pain or discomfort in the jaw, neck, back, or either arm, and 7, sleep disruptions or growing exhaustion in the days or weeks before to the study for women over 60. Warning indications of a massive heart attack can appear as early as 1 week before the event. It's crucial to remember that the less evident symptoms, like weariness and shortness of breath, are more likely to occur. Nausea and shortness of breath. Have you ever had any of these symptoms and dismissed them? Please let me know. I want to be very explicit about identifying these warning flags. For many elders, the first life-saving step is to identify them early and take quick action. Postpone getting treatment, since they're not exhibiting the Hollywood heart attack symptoms they anticipate. This can be deadly if something feels off. Follow your gut, especially if you have when multiple of these symptoms occur at the same time. Don't wait to see if they go away, since you'll find out exactly what to do next. What should you do if you see these indicators? The second recommendation is to call 911 right away and avoid driving yourself. The second life-saving tip may seem apparent, but many elders make the crucial error of calling 911 right away. I can't stress this enough. If you think you could be having a heart attack, don't drive yourself. Activating emergency medical services as soon as possible is the first priority. Every minute matters. Let me provide a heartbreaking American Heart Association statistic for each more cardiac muscle dies after just 10 minutes of damage if treatment is not received during a heart attack. May start to cause serious, permanent harm after 30 minutes, making it irreversible. Happens today. There are 3 main reasons why you shouldn't drive yourself. The first is that driving diverts your vitality and concentration when your heart is already having trouble. Driving really makes your heart work harder. If your illness worsens, that's the exact moment when it needs less strain, not more. Driving, which can happen at any time, and you endanger not just yourself but also other drivers. Third, many people are unaware of this when they dial 911 for help. Starts as soon as emergency personnel arrive, and contemporary ambulances are basically paramedics, and mobile emergency rooms are able to conduct CPR when necessary, give life-saving drugs, and use additionally, defibrillators notify the hospital so that a cardiac team is prepared as soon as you arrive. My patient Anthony, the 76-year-old, who is fiercely independent, originally disregarded this advice when last year, he chose to drive himself to the hospital after experiencing shortness of breath and chest pain. Halfway there, another driver contacted 911 after he lost consciousness and smashed his car, but this resulted in further injuries and wasted valuable minutes of delay. Anthony subsequently told me, "Doc, that was the most stupid thing ever. My life's decision. If you're by yourself when symptoms begin, here's exactly what to do. Stop whatever you're doing. Find a comfortable place to sit or lie down, and then dial 911 right away. Even if you're unsure whether it's a heart attack, let the doctors decide that when you speak with them." In order to assist them focus, the dispatcher states explicitly, "I'm a senior experiencing possible heart attack symptoms." Your call. And if you can, unlock your front door to guarantee an emergency even if you eventually pass out. Rescuers can still enter provided you have, in addition to dialing 911, use a medical alert gadget, which frequently connects you to operators who can remain on the line until assistance comes, such as phoning a friend, or although it may be tempting to phone a loved one first rather than 911, doing so causes a call delay. Call 911 first, then, if you can, your family or neighbors. Have you thought about what if you were alone and experiencing the signs of a heart attack? Please share your opinions in the comments section. Seeking expert assistance right away is the wise course of action. It is not an indication of weakness or overreaction. What you do in the minutes following that call could save your life, as we'll cover in the next advice, is quite important. The final piece of advice is to take aspirin as directed. Time and dosage are important. A straightforward drug that is probably already in your home is the subject of this life-saving tip. But how and when you take it affects aspirin is one of the most effective medications. Thus, it's important to take it at the right time and quantity. Quick therapies in the event of a heart attack. But many elderly people are unaware of how to use them appropriately in an emergency. Because most heart attacks result in a blood clot obstructing blood flow to the heart, aspirin is crucial. Aspirin acts by stopping blood platelets from adhering to one another, which can benefit your heart muscle. Reduce the clot's growth, according to a study published in the American College of Cardiology Journal. Indicates aspirin use during a heart attack can lower death rates by up to 23%. But only if taken as directed by my 68-year-old patient Sylvia. When she felt the symptoms of a heart attack, she remembered to take aspirin, but she made two crucial errors. She swallowed a standard aspirin pill, which also slows absorption, and she took it with a full glass of water, which delayed absorption. The effect was that when we went over what had transpired later, she was astounded to discover the proper technique. Here's just how when you suspect a heart attack, take 325 milligrams of aspirin right away after dialing 911. Aspirin, usually 481 milligram doses, or 1 full-strength adult aspirin. Baby aspirin second. And it's important to chew the tablet rather than swallowing it whole. Aspirin completely before swallowing, which enables the drug to enter your system considerably more quickly, in around 5 minutes as opposed to 30 minutes, when the entire third of the aspirin is ingested with only a drink just enough water to help you swallow. Then dial 911. Notifying the paramedics and dispatcher that you have taken aspirin, along with the precise dosage and time-sensitive warnings if you have a history of bleeding or an aspirin allergy, if you are on blood thinners, or your doctor has specifically told you not to take aspirin, skip this step. Additionally, only take aspirin themselves, not acetaminophen, Tylenol, ibuprofen, or Advil. I advised all of my patients over 60 to continue taking alternative painkillers because they don't have the same blood-thinning effects. Aspirin is readily available in a variety of places, including your wallet, handbag, bedroom table, kitchen, and automobile, in case of an emergency. You don't want to spend time looking through cabinets. Were you aware of this aspirin chewing method during a heart attack? Do let me know in the comments if you learned anything new. Keep in mind that aspirin is not a replacement for while waiting for paramedics to arrive. Emergency medical care is an additional precaution. The combination of numerous lives being saved by timely 911 dispatch and appropriate aspirin administration. And it might also save yours. In our upcoming tip, we'll discuss how to arrange your body while you wait for another element that might greatly affect your chances of survival as emergency responders. Tip number 4. Sit rather than lie down to prepare yourself for survival. Contrary to popular belief, the fourth life-saving technique may surprise you by advising you to properly position oneself when, contrary to popular perception, resting flat isn't always the best method to wait for assistance. Your body's posture during a heart attack can have a big impact on how much effort your heart must put out, and how much for seniors. The oxygen they receive can be especially crucial since cardiovascular systems are already under more stress. Allow me to tell my 77-year-old patient Carlos what transpired. He recalled watching a movie where someone had a heart attack while he was by himself. Heart attack was flat on the ground. He followed suit, although this made breathing more difficult for him and put more stress on his heart. And when the paramedics showed up there, they quickly changed his posture. What's the right position? The response will rely on your particular symptoms. For example, if you're having trouble breathing, which is typical in elderly people, the best position for a heart attack is what doctors refer to as high Fowler's. Sitting up straight, with your legs bent or straight and your back supported, this position enables your lungs to, if you feel lightheaded, expand more completely to improve oxygen flow and lessen the strain on your heart. When lightheaded, it is preferable to sit at a 45 degrees angle or gently lean back. Keeping your head and back supported at an angle helps keep blood flowing to your brain without increasing pressure. On your heart, if you're feeling queasy, which is another typical heart attack, seniors with this symptom should sit up straight and slant slightly to the left. Can aid in preventing aspiration in the event of vomiting. The important thing in every posture is to avoid undue stress by staying in a secure position and not standing or moving around while you wait for emergency assistance. How about loosening tight garments so that you won't collapse if you feel lightheaded or lose consciousness? Common wisdom is accurate, especially when it comes to loosening tight clothing around your neck, chest, or waist. Another crucial factor to take into account is the heart's temperature, which can facilitate breathing and lessen blood flow restrictions. Cold sweats are frequently brought on by attacks, and elderly people are especially susceptible to temperature fluctuations. If at all feasible, wrap yourself in a blanket if you're feeling chilly, because shivering raises your heart rate. Workload: where in your house should you put yourself? Ideally, pick a situated near your unlocked front entrance so that emergency personnel can quickly locate you if you reside in a multi-story house. And if you have symptoms while upstairs, don't try to go instead. Contact 911 and inform them that the exercise downstairs could make your situation worse. Precisely where you are in your house. Have you considered where the most suitable spot to wait for them would be? Please leave your comments below, emergency services, and keep these positioning guidelines in mind. Strategies are short-term fixes while you wait for expert assistance to arrive. They are intended to lessen cardiac strain during those crucial waiting minutes, but they are not a substitute for appropriate medical treatment. In our upcoming advice, we'll go over a method for controlling anxiety and agony during a heart attack. Another element that has a major influence on survival chances for the 5th senior suggestion is to control your breathing using the 478 technique. This life-saving tip deals with an automated process that requires conscious control in an emergency. Use the 478 technique to regulate your breathing to lessen worry and heart strain. Panic is a normal reaction during a heart attack. Your body releases adrenaline, which raises your heart rate, increases, and your breathing becomes shallow and fast, which might make this stress reaction even worse for elders. The condition of your heart and cut off oxygen supply just when your heart muscle needs it most. My patient, Vivian, is 71 years old. She was able to survive thanks to her controlled breathing till paramedics arrived. When I felt pressure in my chest, she said, I was about to freak out, but I remembered the breathing. The breathing method you showed me not only helped me relax, but also provided the 478 breathing technique gave me something productive to do as I waited for assistance. Created by Dr. Andrew Weil and backed by cardiovascular medical research, is straightforward but effective. As explained in our guide, the first step in performing it during a suspected heart attack is to sit in a comfortable, supported position. Last tip: then press the tongue tip against the ridge behind your upper front teeth and hold it there. During the exercise, then release all of the air from your mouth with a soft whooshing sound. And finally close your mouth and silently inhale through your nose for 4 mental counts. Then, hold your breath for 7. Be challenging if you're having trouble breathing. If so, hold for as long as it feels comfortable. Even if it's only exhale fully through your mouth for a count of 2 or 3, then again for a count of 8, repeating that same motion. Whooping sound should be repeated at least 4 times, or until an emergency occurs. Why this method works is that the prolonged exhale triggers the rest and digest system, often known as the parasympathetic nervous system, inhibits the panic reaction for when a senior has a heart attack. This can raise oxygen levels, lower blood pressure a little, and slow down heart rate. Efficiency is all advantageous during a cardiac attack, according to research that was published in the Journal of Emergency Medicine. Up to 28% less pain is seen when breathing is managed. More significantly, less anxiety during acute cardiac episodes translates into less. Another advantage of adrenaline rushing through your body is that it lessens the strain on your already overworked heart. For seniors in particular, paying attention to your breathing gives you a sensation of control during a terrifying circumstance that can improve your decision-making and allow you to speak with emergency personnel more effectively when they arrive. Have you ever employed breathing exercises in a tense situation? If so, give your experience in the comments section below. Keep in mind that this breathing method does not take the place of medical care, but it's an effective supplementary strategy that could increase your window of opportunity to survive as you wait for expert assistance. And it's also a tool you can start using right away without any equipment or preparation. We'll talk about a contentious, but possibly life-saving method that should only be applied under certain conditions while suffering from a cardiac assault. Tip number 6. If required, self-administer chest compressions. The sixth life-saving suggestion deals with a dire circumstance that calls for information that most individuals lack. Conduct chest compressions on your own if you start to lose consciousness. I want to be completely obviously, you cannot conduct traditional CPR on yourself. It's a physically effective. Chest compressions cannot be performed on oneself while unconscious. However, there is a modified method that can be useful in dire circumstances when you're by yourself and start to feel like you're losing awareness. Is contentious in the medical community, with some physicians reluctant to teach it. However, after 40 years of cardiology practice, I think elderly people should be aware of all their alternatives. My patient, Samuel, is elderly. 74 employed this method while he was by himself in his cabin and felt himself fainting from a heart attack. He later informed me that I was certain I would die, but that trying this provided me a chance to live until my neighbor overheard me. And here is the updated self-compression procedure after dialing 911. First, lie down right away if you start to lose consciousness while you're waiting for emergency assistance. Next, create a fist on a hard surface, ideally the floor rather than a bed or plush couch. Using one hand, lay the knuckle side of your fist over your sternum or breastbone in the middle of your chest. Press your fist firmly against your chest with your other hand, then let go to compress. Try to keep a cadence of roughly 100 compressions per minute while chesting about 2 inches deep, which is about the beat of the Bee Gees song, "Staying Alive." This is the same beat that is taught in CPR lessons. Why might routine CPR be effective? Continue until assistance arrives or you regain more stable awareness. This modified method of manually pumping blood through the heart when it isn't beating efficiently may offer some blood circulation, but it is not as beneficial as appropriate CPR if your heart enters a hazardous rhythm, administered by someone else. But if you're by yourself in a life or death emergency, it could assist pump blood to your important warnings for the heart and brain. This method poses hazards, especially for elderly people with osteoporosis or a history of rib fractures may be at risk for ridge damage. Although the majority of medical experts concur that when cardiac arrest is the only other option, that it's fair to try this method, it's really a last resort. So your main priority should stay positioning yourself, taking aspirin if necessary, and dialing 911. Have you ever learned CPR or any other emergency breathing techniques correctly and using the technique we covered earlier? Strategies. Share your story in the comments section, and let me know whether you believe that more seniors ought to receive emergency cardiac procedures. Keep in mind that getting professional medical assistance as soon as possible, and all of these self-administered methods are short-term fixes intended to prolong your survival period till appropriate medical assistance arrives. In our last piece of advice, we'll talk about important details you should have ready beforehand to help you save valuable time during an emergency. The seventh piece of advice is to plan ahead and make a heart attack action plan. The seventh and last life-saving tip, perhaps the most crucial of all, is to make a customized action plan for heart attacks. The truth is that during a heart attack, Your thoughts become confused by pain, panic, and even the possibility of dying before you ever need it. For seniors, the physiological implications of decreased blood supply to the brain can affect their ability to make decisions. This cognitive effect may be much more noticeable in my 79-year-old patient, Louise. She believes that her life was saved by her careful planning. She had made and reviewed a thorough action plan. She didn't have to believe. She just followed her when she frequently had heart attack symptoms when she was by herself. Step-by-step pre-planned strategy in that panicky moment. She informed me of having a strategy that I could follow mindlessly made all the difference. Here's how you make your own heart attack action plan. Make an emergency medical information card first, which should contain your entire name, age, and any medical issues you may have. Keep a copy of your doctor's information, current prescriptions, allergies, and emergency contacts in your wallet. Clearly visible in your house. A lot of elderly people use their refrigerator door with second-place aspirin in key spots throughout your house. And keep in mind that you should have real aspirin in your pocket or purse, not Tylenol or additional painkillers, ideally the uncoated variety that are easily chewed. Third, program emergency contacts in the event of an emergency. Put ICE into your phone before their names so that first responders can quickly locate them. Take the time to set up the emergency medical ID feature on your smartphone. Fourth, think about getting a medical alert gadget. Modern options, particularly if you live alone, include pendant-style warnings, and clearly, the fifth functionality of smartwatches is emergency calling and fall detection. Put your home's number on it so that emergency vehicles can find it easily. The numbers will be visible from on the roadway. You can rehearse your emergency reaction and save vital minutes by using the roadway. Truly follow the instructions we went over, including where to sit, where to find your medication, and how to unlock doors. When your brain is compromised, muscle memory can take over quickly. Eventually, discuss your plan with your family or neighbors. If you live alone, think about setting up regular reviews and updating this plan every 6 months or more, especially if you have known heart concerns. Every time your prescriptions or medical circumstances change, there's one more thing that's especially crucial for seniors with heart conditions: talk to their doctors about whether they should keep nitroglycerin at home. This prescription drug can enhance blood flow during a heart attack by dilating blood arteries. You made an emergency plan for yourself or a senior family member. Share your thoughts or inquiries in the comments below. By planning ahead, you're taking charge of your life and avoiding dread, improving health and greatly boosting your chances of surviving in the event of an emergency happens. Let me tell you what happened to Richard, who I introduced at the start of this movie. Richard was 72 years old when he was after his wife died one day. An energetic gardener who lived alone as he worked in his garden, he started to feel what he subsequently characterized as odd pressure and exhaustion in his upper back. As we had already talked about the warning indicators unique to seniors, Richard identified them as symptoms of a possible heart attack rather than dismissing them as gardening stress. He instantly halted his activities and triggered his plan by dialing 911. First chewed an aspirin from his pocket, then sat up straight and steadied himself, concentrating on his most significantly. He had unlocked his front gate that morning and was breathing utilizing the 478 technique that we taught. Paramedics arrived within 12 minutes and started working on the habit he formed as part of his heart attack action plan. During medical care, doctors determined that Richard was experiencing a severe heart attack, with a 95% obstruction known as the widowmaker in his left anterior descending artery. Richard's heart sustained only minor damage as a result of his prompt action and the actions he took while awaiting assistance. After several months, he returned to his garden with some prescription modifications and a renewed sense of gratitude for planning. I always assumed that Richard would notify me right away if I had a heart attack during his follow-up, but the symptoms were not at all what I had anticipated. Had we not discussed what to search for and what to do, I definitely would have assumed I was exhausted by the time I understood what was happening and simply sat down to rest. It could have been too late, but Richard's experience isn't out of the ordinary in my profession. I've witnessed innumerable elderly people withstand severe heart attacks with little harm. Since they were aware of you now and know the 7 life-saving strategies that could make all the difference in those crucial first few minutes. Difference if you have a heart attack by yourself. Keep in mind seniors' particular warning signs. Dial 911 right away and take aspirin as prescribed. Arrange yourself for survival. Regulate your breathing and refrain from performing self-administered chest compressions for severe circumstances. And above all, if you discovered this, make your heart attack action plan now, before you need it. Useful information. Kindly click the like button and show this video to a loved one. You might just for other life-saving tips. Please subscribe to our channel. Created for seniors. Please share which of these suggestions surprised you in the comments section. You the most, or if you're unsure about how to create your own heart attack action plan, keep in mind that preparedness and information are key. Are the most effective ways to prevent heart disease. Until the next time, this is Dr. William Carson, hoping your days ahead are heart healthy.